We will be performing overpressure tests for hip flexion, extension, abduction, and adduction. Overpressure tests are an application of force in the direction of movement at the end of available range. It's used to stress the area of expected involvement or to screen to clear a joint or a particular movement. Overpressures are contraindicated when active motion is painful. They are indicated when attempting to identify areas which require further testing, when assessing acuity and chronicity of a patient's problem, and to stress the joint capsule, ligaments, muscle, and soft tissue around a joint. Steps to perform overpressures. Number 1, introduce yourself to the patient and describe the purpose of the test, what they should expect, and what questions you will be asking.
Hi Carmen, my name is Lisa Meyer. I'm going to be your physical therapist today.
Nice to meet you.
Today we are going to go through a few tests on your hip. They're called hip overpressure tests. And the purpose of the test is to take your hip into the end range and stress the structures in and around the joint to see if it reproduces your symptoms.
Okay.
So what you can expect is to possibly just feel a small stretch. It may reproduce your symptoms, or it may be completely symptom-free.
Okay.
All right, so when I bring your leg through the motion, I'm going to ask you, does it reproduce your symptoms? And then if it does, I want to know where, and then I'm going to have you describe the symptoms to me.
Okay.
Number 2, ask the patient to perform active range of motion for the specified motion you are assessing. Number 3, ask the patient if they have pain with the active range of motion. If they do not perform the overpressure. If they don't, continue with the overpressure. Number 4, passively perform motion to the end of the patient's available range. Number 5, apply overpressure just into resistance. Number 6, ask the patient if it reproduces their symptoms. Number 7, document the information gained from the test. The information you are documenting includes the quantity of the movement, the quality of the movement, the end feel, and the pain resistance sequence. It is important to note that clinically, you would drape your patient appropriately, as well as perform the test on both sides.
I'm going to have you bring this knee up to your chest. Any pain with that?
No.
Okay. I'm going to stabilize here and bring you through that same range. It's the end of your range. A little overpressure. Any symptoms?
No.
Okay, great. Okay, for this motion, I'm going to ask you to extend this leg up off the table. So lift. Good. Any pain with that?
No.
Okay. I'm going to take you through that same range of motion, and I'm going to apply some pressure on the back of your glute here.
Okay.
To stabilize. So there's the end of your range. Apply a little pressure. Any symptoms with that?
No.
Okay, great. This leg is going to slide in without moving your hip. Great. Back out. Any pain with that?
No.
Okay. And bring you through that same motion with my hand stabilizing it through your hip here. Okay. Knee across. And pressure. Any symptoms with that?
No.
Okay. Slide your leg out towards me. Great. And back. Is there any pain with that?
No.
Okay. What I'm going to do is stabilize here at your hip. I'm going to bring you through that same range of motion. There's the end of your range. A little past. Any symptoms?
No.